Podcast ini dibawakan khas kepada anda oleh NAZRI Baobed.
Assalamualaikum semua, saya ejen NAZRI BAOBED daripada ERA. Alhamdulillah, I've been a property agent since 2015. That will be 10 years already. Saya sudah tolong first timer buyers, upgraders, downgraders, yang jual saja, kes farid, kes cerai. Alhamdulillah, macam-macam kes dah buat. Kenapa saya nak jadi seorang property agent? Actually, memang nak bantu ramai orang masyarakat kita lah. What happens kalau anak makin berbesar, anak dah ramai? How can they move to a bigger place, more bedrooms, ataupun nak dekat dengan parents, ataupun tempat kerja, tempat sekolah terlalu jauh? How can we solve this problem? And on top of that, to do this whole sell and buy process as safe as possible. Kadang-kadang maaf kata, sekarang masih ramai orang juga, dorang upgrade ataupun jual dan beli. Every month dorang kena top up cash. I try to be different from other agents, try to offer a solution that can let you upgrade or shift from one house to another house without topping up cash, especially without overstretching and without financially burdening yourself in the long run. Actually, I come from a background that is nak cakap below average pun ada, because my father was a sole breadwinner. Pindah sini, pindah sana, struggle financially, ni semua kita dah pernah go through. So that's why I would like to help kita punya community, jadi kita can get through the struggle and achieve kita punya financial portfolio successfully lah. Kalau sesiapa yang perlu bantuan tentang hartanah, especially whether diorang nak jual ke ataupun nak beli sebuah rumah ke, jangan segan-segan hubungi saya di 90688244. InsyaAllah saya akan bantu. Dan juga kepada penjual yang nak tahu berapa harga rumah pasaran mereka, diorang boleh WhatsApp kepada saya, postal code mereka. InsyaAllah saya akan tolong cek. Saya NAZRI BAOBED. Assalamualaikum.
Hey, welcome back to another episode of Outside In with your host Yanto
and Farah, your go-to source for honest conversations about relationships and
marriage. So if you are ready, let's go.
Let's go. Alhamdulillah.
I'm very excited today.
Kenapa?
Because I feel like I'm in a consultation.
Oh yes.
Right. Because our guest today is mashallah tabarakallah.
Mashallah.
Is also a big shout out to Haryani Uthman for getting us in touch with our guest for today lah.
Yes. So like we know kita kan marriage podcast kan.
Yes.
And we want to educate ourselves and make our marriage lives better lah insyaAllah. So dengan guest kita hari ini, he seorang doktor
Yes,
that
doctor.
specializes in men's health. So hari ni kita tahu korang yang dengar ni banyak perempuan, banyak isteri-isteri kan.
Isteri, mak-mak yang kat rumah tengah lipat baju.
Yes. Saya pun seorang isteri, right? So I want to learn a bit more lah how I can help my husband and together we can improve our marriage.
Yes.
Right?
At the same time at the same time also of course, like we mentioned earlier on, we're going to talk about men's health and all that. We are not disregarding women's health or women's mental health, but for today's episode especially, we're going to touch on men's health. So like what Farah mentioned earlier on, for all the mothers, wives out there yang kat rumah ataupun yang kat kerja tengah mendengar ni, kalau you dengar this episode, you feel like, oh, I think this would benefit my husband. Then you take the parts yang you think that it's beneficial for you and your husband, you take it, you screenshot it, you post it on Instagram, you tag us and you tag your husband. Macam gitu.
Because to be honest, we all know that women are the ones who usually macam look and research and educate ourselves lah basically. Kalau cakap pasal nak pergi kelas agama ke apa ke, nanti selalunya perempuan yang ayah jom drag them to the place, right? So we are speaking to the right audience.
InsyaAllah. Then but then also we don't disregard the men yang mendengar kita punya podcast. We ada juga yang alhamdulillah yang dengar kita. Terima kasih brothers for listening to our podcast also. InsyaAllah it will be beneficial for you and your wife also, insyaAllah.
So,
right?
Without further ado, I'd like to introduce our guest for today,
Dr. Taufiq. Apa khabar, Doktor?
Hi guys, thank you so much for having me today.
Thank you.
Welcome.
Alhamdulillah, I think it's an honor to have you, our very first doctor, practicing doctor in our podcast, and is nervous and excited.
It's also nice to see lah macam orang Melayu kita macam jadi doktor,
Masya-Allah,
and like have their own practice, right? So kita nak kenal lah lebih dengan Dr. Taufiq ni. If you could tell our listeners who you are, introduce yourself and your clinic.
Okay. Hi everyone, my name is Taufiq Rashid. So I'm a medical doctor focusing on men's health. So I've been practicing men's health for the last 8 to 9 years, and I actually just started my own practice over the last few months.
Alhamdulillah.
So, alhamdulillah, I feel now is the best time to be able to help more people in my own needs.
InsyaAllah.
So kalau korang perasan, doktor tengah pakai dia punya scrubs dia.
Very nice.
Yeah, I like the fact that he texted me, he's like, can I come in my scrubs? I was like, please do. Yeah, because it shows this is what you will see when you consult Dr. Taufiq for his during your consultations lah.
Yes. Your clinic ni, what is it called?
So my clinic is called Tough Clinic.
Tough.
Yes.
So Tough actually, the name Tough started from the idea of calling it Taufiq and Friends or Taufiq and Family. But then I realized that I want to make a space that is for everyone. So you can name it whatever you want. It could be trim and fit. So if you want to stay fit, it could be testosterone and fitness. So if you want to be fit and healthy. Or it could be trim, abundant foreskin if you want to sunat. So so you can think of whatever creative terms for TAF.
I like that one. Trim abundant foreskin.
Alhamdulillah, congratulations on your new clinic. So you ada your own practice. Wow, it's really hard to see people who own their own practice macam open to going on podcast and sharing. I think there's a bit more restriction lah kan kalau you are working for the government.
Yeah.
So in your experience ni, you have worked in government and also private sector lah. And now you open your own clinic.
Yes.
Very nice.
So in terms of men's health, you said 9 years kan. So when did you start becoming a doctor?
So I graduated in 2006. So at that time, only got one medical school in Singapore. Now got 3 lah. So I graduated from NUS 2006. Then practiced in the government hospital for a while. After I finished my bond, I came out and started in private sector.
Okay. And then your clinic ni, what kind of services do you offer?
Okay, so when I talk about men's health, I focus things like things related to low testosterone or testosterone replacement, erectile dysfunction, things related to men like even premature ejaculation. We also provide things like circumcision. So circumcision not just for kids but also for adults. And I also have a weight loss service. So weight loss treatment management as well.
Interesting. Seems like we need to have another consultation after this. Okay. I mean, of course, alhamdulillah, we've been on a journey to lose weight also. Why not? Why not? We might have more on that also.
Why not?
All related,
All related, definitely, mashallah. I mean, talking about men's health, or whatever services that Dr. Taufiq has already mentioned, kan. I feel that it is essential for us to talk about it over here in outside in also because it affects the men's health. Generally affects the whole family as well because like the issues that you mentioned, erectile dysfunction, premature ejaculation. No, this is not going to be a R21 kind of content. It's more educational purposes for educational purposes. Yes. I think before we go deep into the topics that we're going to talk about, Dr. Taufiq actually brought along with him some toys.
Some toys and
yes.
some things.
Purely educational and for informational purposes. Yes. This is not for fun. We label it toys because it's something that Hairani Uthman informed us. Tell Dr. Taufiq bring his toys. Toys? So he has with us a bag of toys lah, basically. So maybe this is what he does on a daily basis for his practice. Yeah. So he will show us what are the toys and the functions of it.
Okay, one of the devices is this one.
What is that?
So this is what we call a vacuum pump.
Vacuum
pump.
So it's actually designed for the penis.
Okay.
So main purpose would be to improve erection, improve blood flow.
Okay.
So the of course some people may say that I've seen this in the sex shop or I've seen this online, but this one is a medical grade because you know exactly the pressure that you are applying, which is what you actually need for the recommended benefit without the side effects. Like if it's too long or too strong, right, may cause problems.
Alamak.
We'll go deeper into that because I'm very curious about that.
Very interesting contraption. Yes.
Then
this one even more interesting.
Yeah, this one I've seen it on on Dr. Taufiq's TikTok, which you can find. What's the
Dick.SG.
Yes.
Dick.SG. So this is a stapler circumcision device.
The word stapler though.
Yeah, so some people say it looks like a wine opener. It does.
Oh yeah.
So that's the stapler device, and then the other device for circumcision is actually called the shang ring.
Shang ring. Shang like the Shang.
Shang-Chi.
Shang-Chi.
They also got rings, right?
Yeah.
Yeah, so this one is a plastic device, so smaller and less invasive than stapler. So usually I use this for kids lah.
Okay.
So less intimidating.
Parents, if you are listening, if you know you nak sunatkan your anak, bolehlah pergi dekat Dr. Taufiq.
Yes.
Interesting.
Actually, can also. I mean,
Alamak, itu untuk apa?
educational purposes. Okay.
Oh, okay.
No, normally I use this
Demo,
model sometimes to show to patients, certain things about foreskin or penis health, or even to how to use the vacuum pump and all that. So it's something that's easy to show them with a model.
Right. Sebab takkan nak keluarkan sendiri punya kan.
Jangan macam ni. Alamak, suami ni. Okay.
Right. So that one you can actually pull the foreskin.
Yeah, so it comes with a foreskin, yes.
Apa geli aku. Ada yang gila-gila sikit. Right. So this is what you show in terms of let's take for example I'm a patient that I want to sunat with Dr. Taufiq lah. Okay. How would the whole consultation be? Example, just a brief one. Maybe you can
so if you're an adult, so of course first I will ask, okay, what's the reason that you choose to sunat lah? So could be various reasons. Could be maybe it's tight, cannot pull it back. Maybe it's causing pain, discomfort during intercourse. Maybe it's infected. Maybe it keeps getting infection. So then circumcision helps to reduce the risk of the infection.
Okay.
And then of course there are those who are coming in because of religious reasons. Could be hygiene. So there are also more and more non-Muslims, adults who are coming in because they prefer it to be cut.
Interesting.
Usually kalau like adults tu, we don't know how. I mean, I personally don't know how it's going to be because dah sunat kecil-kecil kan. So what are the kinds of infection that can come from non-circumcision or non-circumcised?
Yeah. So because they still have the foreskin, so the foreskin makes it conducive for bacteria or fungus to grow. So because it's covered, it's moist, it's warm. So a lot of these men have problems of repeated infection. And sometimes because they keep getting it, the best way is really to get circumcised so that they don't get it anymore.
Right. That's for beneficial medical reasons also lah kan. What are the other benefits of circumcision other than infection? Because the tightness tu, is it because dia tak boleh expand ke macam mana?
So okay.
Coming from a man, I'm very curious.
So tight foreskin, the medical term is phimosis. So phimosis is where the skin is too tight, you cannot pull it back. So in some cases it's so bad, they cannot pull back, they cannot even clean inside. It's too tight, and then when they have sex it's painful because it's tight, right? So when it's moving, it's just very uncomfortable. So they get frequent infection, and there are some cases where they were okay before, but then because of the repeated infection, it causes swelling, scarring, then it becomes tight because of the infection. So I do see these cases in older men or those with diabetes or smokers because they have a higher risk of getting infection.
Interesting.
Because I know if a skin tears and then infection, then it will repair itself and then it loses its elasticity.
Yes, you have scarring, it becomes harder, and then it becomes tighter and tear again. It becomes worse and worse, so it becomes a vicious cycle.
Oh god. So go get circumcised, guys. It's healthy.
Alhamdulillah lah, Muslim brothers kita dah memang circumcised. Korang dah memang circumcised dari kecil. So Islam has thought of this way even before macam itulah for medical reasons.
Yes. Men, brothers out there, korang ingat tak when we were younger, when we were very small, and then we have to go to sunat, selalu menangis, takut pasal we always see all those videos that you see dorang lari daripada pakcik, cepat nak sunat. Dia lari satu kampung tu. Then dah sunat kena pakai kain, tapi nangis nak kencing pun takut. So what are the benefits of this current technology nowadays that comes with circumcision?
Is it painless?
Yeah, so I remember even my time, it was so traumatic. That is the only thing that you remember your whole life.
For life. Betul. And lucky it's only one time.
Yeah. So no matter how much I want to be brave, I was not brave because it was traumatic. But what I see with the current technology is so easy because first of all, there's no injection required.
Okay.
Oh, serious?
Yeah, no injection.
I remember I kena sih.
Of course. I also got it. So you just need numbing cream.
Cream.
Just apply cream, leave it for 45 minutes to an hour, and then numb, and then can start already. Yeah, and then the procedure is so simple. Maybe 5-10 minutes done.
Right.
And then while doing the procedure, they can play the phone.
Oh,
They
faham.
can watch a video.
Distract themselves lah.
Yeah. And most of the time, they don't even finish the video finish already.
Alamak, you see, budak zaman sekarang, they have it easy.
Itulah budak-budak strawberry dia. I mean, if I were to recall my incident, going for circumcision when I was in primary 2, June school holidays, I remember very clearly. Traumatic kan? I remember, the doctor was asking me, he tested, he take a tweezer, pincher, is it? He pinched a bit of the skin down there lah. And sakit tak? Dia like, doktor sakit. Alamak sakit macam mana dah gitu tau. Alamak macam mana.
Tapi dah injak kan?
Allah tak ingat. Pasal I was like, all the way I'm just crying non-stop. I gembing kan. So I was crying non-stop. And then tengah baring gitu lah, Papa I don't want. My father was just like, nanti dapat PlayStation. PlayStation.
Wah, dapat PlayStation not bad.
Betul lah. Nak dapat PlayStation.
Pasal macam for pregnant women, when they give birth, they get push gift kan. Sunat gift.
Sunat gift. Okay, insyaAllah.
Then dia dah potong tu, dia doctor, okay, nak tengok? I said, tengok. So I stood up and I sit up. And then I looked at it was like filled with blood everywhere. Then I just like balik. Yeah, that was my traumatic experience lah. Yeah. But is it still as bloody now?
No, because especially with the shang ring, because once it's clamped, right, no more bleeding already. So it's very smooth, very fast.
Right.
And then even like afterwards, passing urine is also not as painful like last time.
Wow.
Dengar tu.
My goodness. Okay, for maybe for the mu'alafs or not for the men who are non-Muslim who wants to go for circumcision, you won't go through what we go through lah.
Yeah,
InsyaAllah.
exactly.
And also
So
parents lah.
a lot of the mu'alaf, right, they always tell me that their Muslim friends will scare them. They tell them, no, it's very different now.
Yeah, there's better technology now.
Yeah. Wow,
Okay.
masyaAllah.
So itu berbual pasal circumcision lah. So parents, you know where to go to now.
Yeah.
Kan? If your anak dah come of age, it's time to sunat. Just go to clinic Dr. Taufiq.
Yes.
InsyaAllah.
But can they like tell you like, doctor, traumatize him?
No lah. I want to traumatize somebody.
Right. Okay.
Yeah, so now kita nak go more maybe towards a bit of marriage punya side lah, kan? So I think a lot of insiders already know kita punya situation.
Yep.
But now that we have Dr. Taufiq here, maybe we can get a little bit more explanation now of our situation.
Yeah.
So just a brief punya apa?
Description.
Sharing, brief punya sharing is that Yan have a bit of fertility issues,
Yes.
right?
I would say a bit lah.
A lot.
It is a fertility
Yeah,
issue.
it's a fertility issues.
Yeah.
So kita nak tanya Dr. Taufiq, is testosterone ni directly impacts or related to fertility for men?
Okay, that's a very good question. In fact, I actually applaud you for being honest about your situation because very few men would want to be able to come out and share this issue because I think most men don't want to share certain things about their condition because of ego and all that.
Yeah.
So I think it's important that you share so that other men out there who maybe need help can also seek the help they need. And I think your question about testosterone. So testosterone is a male sex hormone. So it's naturally in us. So when we're younger, it's the highest. Maybe when after puberty, 18, 20, 21, it's like the peak. So as we age, of course it goes down gradually, eventually.
Okay.
So the purpose is mainly for like sex drive, sexual function like erection, energy, muscle growth, mood, even so helps with the positive mood. So these are some of the main common effects of testosterone.
Okay.
So fertility, not directly. Of course, testosterone having the sexual function is important for fertility, right?
Yeah.
But then fertility, the other aspect would be the semen, sperm, and the quality. So that one will be related to other hormones that stimulates the production, the formation of the sperm, and also that's contributed to by your lifestyle. So a lot of times they're very separate treatments. If you have low testosterone, it's a separate treatment. If you have fertility issues, it's a separate treatment. In fact, if you are treated with testosterone, your fertility may be affected because too much testosterone will suppress or affect your sperm production.
Interesting.
I did not know that.
Yeah, interesting.
So kalau everything also has to be in the right amount lah, in a sense kan.
That's right. It's about balance.
Right.
So doesn't mean you have high testosterone. Your fertility is
Top notch.
Top notch.
Yeah, so they require different tests and different assessment.
Faham. Macam mana ni? Dah tak ada ejen nak aku. Yang cuma nak aku kucing ni je. Nazri? Kat Melaka? Nazri! Nazri! Nazri!
Ha?
Nazri!
Yang tu, kau kerja aku all the way sampai kat Melaka?
Dah tak ada ejen nak saya, Nazri. Macam mana? KZB loan dah apply 2 kali. Appeal kat MP pun kena rejected. Nazri boleh bantu?
Boleh Yanto, insyaAllah. Kepada para pendengar, jangan risau. Kalau cerita awak macam si Yanto ni, dah pakai HDB loan 2 kali, dah kena reject dengan MP berkali-kali. Once again, jangan risau. Saya pernah bantu client that is similar exact story macam gini. Maaf kata, dia dah kena reject by ramai agents because ramai agents ingat kes dia terlalu complicated sampai tak boleh buat. Tapi Alhamdulillah, I dah follow up dengan this client of mine, a 3-room BTO flat seller for 2 years tau. Bayangkan, you nak cuba sedaya upaya for your family of 7 staying in a 3-room BTO. Diorang almost wanted to give up. Tapi again, my key point for you is do not give up. Sampaikan they successfully upsize to a 5-room flat. Tengok, you know that it can be done. InsyaAllah. Sila hubungi saya di 90688244. InsyaAllah saya akan bantu anda. Saya NAZRI BAOBED. Assalamualaikum.
Right, so nak kata pasal testosterone ni kan. So generally we always we see a lot of gym bros out there, you know. They take like testosterone boosters, you know. Some even take testosterone jabs and whatnot. So is that actually good for men in a way? Because you mentioned earlier on testosterone affects mood kan. So like excessive
Let's go to the misconceptions. Misconceptions of testosterone. We go one by one lah. We have quite a list. So kita nak belajar and then we want to find out, is this a myth or is this actually true? Right.
Okay.
So the first one, misconception of testosterone. Testosterone is just about muscle and aggression. Like you said just now tadi kan, kita kalau fikir testosterone, kita fikir macam the gym bros, pergi gym, you want to pump iron, right? Testosterone, so you get mass and muscle. Is testosterone really just about muscle mass?
Yeah, so it's definitely a myth. So I think testosterone has been victimized or being being the villain. Like they say that it's only good for muscle and aggression. But actually, especially for men 40 years and above, is something that is very useful for this group of men because it helps to restore natural levels of testosterone or normal levels. So that you can restore back all the feelings of like sex drive and energy and mood even. Because some men, they may have low mood or irritability is because of low testosterone. It's not because they're old, it's not because they're stressed, but because their hormones are low.
We don't know that. It's about, honestly, sometimes we see our husbands kan, even our fathers sometimes balik kerja macam penat, lemau
kan. I think especially back then when I was working shift work kan, a lot of late nights, a lot of long hours of working. Dia punya level, energy level is always very low. Then in terms of wanting to be a good husband to my wife is a bit on the steeper side because it affects, because my mood is not there. So I can't really, become a best husband in a sense.
So is it safe to say, doctor, kalau a man has low testosterone levels, it can affect their energy level, their mood?
Definitely.
Can become depressed.
Yes, and then eventually it may affect marriages because they may think that it's just them. They may think that it's just part of aging, but it's not. It could be something that they can fix, they can solve.
Right.
So that's why sekarang a lot of people selling supplements.
Yes.
Now talking about supplements, kadang-kadang kita buka TikTok, kau banyak, right? A lot of supplements, right?
Off the over the apa they call it?
Over the counter.
Over the counter.
Over the counter. I think my husband also has bought a couple of them.
I want to feel better, kan?
So macam for people like them ni, is any testosterone boosters safe for them to use, or is there any guidelines that as a professional you can share with us?
I think it's when it comes to supplements, it's a little bit tricky because if today you look up, even if you ask ChatGPT, right, you get a lot of ingredients that they will tell you that is good for you.
Okay.
So then how do you know which one is good for you, right? So it's gonna be a bit difficult. So one is which ingredient. Second is what's the dose. Sometimes it's not always the more the better.
Right.
So it's a bit tricky to know the right ingredients, the right dose, and maybe you have no problem with testosterone in the first place. Maybe your testosterone is fine. So if you're taking it, then if your testosterone becomes too high, there may be a problem too.
There may be a problem also.
Wow. So the best is always go contact Dr. Taufiq.
Get an assessment first before you sort of solve it on your own. Because there are people or there are guys with normal testosterone but with erectile dysfunction. Then if they're taking something for testosterone, then it's not going to solve the erection. It may even worsen it.
Wow, the body is it's an amazing thing. A lot of things.
No, sekarang, I mean, even Yan macam his group of friends, they will usually talk about, kau ambil supplement ni, supplement tu. As a man, macam even if I were a man, I dengar kawan yang cakap, okay lah, it's a supplement, it will help me in some form. But macam Dr. Taufiq cakap tadi, kalau your testosterone levels dah biasa, then you eat, then you increase the testosterone in your body, it could possibly lah, do some harm to your body.
Dia macam ibarat apa tahu, kita pergi doktor, okay, we don't talk about going doctor, kita macam tak ada sakit, tak ada sakit, lepas tu kita pergi pharmacy, I just want to get Panadol. Why? Just in case. When makan Panadol tak ada apa-apa, then boleh jadi overdose.
You get the side effect instead of the positive effect.
How do we check testosterone level?
So you have to do a blood test, come to see the doctor, and then so not all doctors may be able to do the full test, or depending on what your symptoms are, your concerns are. Testosterone alone may not be enough. You may have to check other hormones like prolactin or FSH, LH, free testosterone. So there might be a whole long list of tests. It's not just testosterone, because some patients will tell me, I just want to test testosterone, but then it may not be enough. That alone, it could be other factors that contributing to your symptoms.
So if you go see Dr. Taufiq and you get an assessment, then you would know how much dose you will recommend lah, how much dose you need for this, and
If
how
you
much
need it.
for that.
If you need it.
If you need it. If you don't need it, don't take testosterone. Okay. Let's go for the second one. Second misconception of testosterone. More testosterone means more masculinity.
Masculinity, is it?
Macam lagi banyak testosterone, lagi jantan.
Jantan.
Right.
Is this a myth? Is it true?
So like we mentioned, it's all about balance. No? Our whole body, the purpose of hormones is for balance. So you cannot go too much and you cannot go too little. So just now I mentioned, if it goes too high, then there may be problems. In fact, our body has a natural way of managing the testosterone that's too much. So it gets converted to estradiol, which is similar to the estrogen in women. So then if then you got too much estradiol, you may have problems like gynecomastia, which is like man boobs. Or you can have problems like
mood swing ada?
mood swings,
Serious?
water retention. So sometimes maybe those guys who go gym and take a lot of testosterone with too high doses, they may get all these symptoms as well.
Just a quick I teringat this video, this guy dia pergi gym, ada sapau sado gila. Lepas tu then, I don't know whether it's a satire kind of content, but dia begitu, lepas tu after that nanti dia tengah dengar lagu some set
emo
set-
song.
then dia macam nangis gitu, tapi badan dia tengah sado gitu, gila, the mood swing.
That means
So actually
too
it's
high
real
lah.
It's real.
Testosterone is too high.
Wow, okay. So doesn't mean kita ni banyak sangat masa. So you are like a man lah. So being a man itself is a whole agenda itself lah.
Correct. It's all about balancing. It's not about too very high, very low. It's about having the right amount.
Right amount. Wow.
Okay.
Nak kata right amount, everybody is different lah.
Yes, that's right.
That's why you need to get it checked. Because
kan.
everyone is different.
Right.
Okay, number 3. Low testosterone just means low sex drive.
Okay.
Is this a myth? Is this true?
So low sex drive, actually most of the time they come to see me is because of low sex drive. Majority of the time.
Okay.
But then there are also other symptoms. Other symptoms like low mood or easily angry, weaker erection. Sometimes they don't notice. Maybe you're supposed to have nocturnal erections or morning erections. That means spontaneous. Morning wood. So it's supposed to be spontaneous. But as we age, that sort of like gets less. But for some guys, they get almost none. So then there's another sign. So sometimes they also notice it's difficult to lose weight. And they tend to have more fat around the tummy.
Oh, that's me.
And then difficult to gain weight. Some of them they work out 3-4 times a week, but the muscle doesn't go up, or the strength is never getting better. So these are also other signs. And then sometimes they lose interest in common things that they usually like. So like losing interest in their hobbies and things like that.
Okay. So it doesn't mean low sperm.
Are you describing me, doctor? No, are you describing me? Because it feels like that's part of me also. Losing interest in this and that. But that is generally what aging men go through. Yeah. Is that like what are the possible ways to improve? Because like we mentioned earlier on about men's health, kan, we want to do all these kind of things because it makes us feel happy and things like that. So what are the ways, generally, what are the ways we can actually improve this whole condition for us?
You mean like the low testosterone?
Yeah.
Okay. So you can improve it naturally. So it all goes back to lifestyle again.
Okay.
So what are the things that help would be things like make sure you have enough sleep. So preferably 6 to 8 hours of uninterrupted sleep.
Okay.
Stress is another big factor. So I do see some men who are healthy, fit, but they are so stressed. The stress is affecting their testosterone levels. So their job is high stress. So they're always on the go, not enough sleep, always working long hours.
Okay.
So that will affect. So you need to find ways to manage the stress.
Right.
So there's like a silent epidemic as well. It's the causes of stress. And then you also need to make sure you eat healthily. So no junk food, no processed foods, more lean protein, more fruit and vegetable. Don't take too much carbs, even too much sugar, or even generally sugar is bad for you. So there's the diet. Exercise, very important. Always encourage men to lift weights. Lifting weights. Even if you don't lift weights, maybe do body weight exercises like push-ups, squats. So there's a lot of benefits, not just testosterone, but a lot of other health benefits to building your muscle and boosting your muscle growth. So I do see quite a lot of couples, and sometimes they are getting younger and younger.
Oh,
Yeah, so
younger.
usually you expect maybe 40 plus, 50 plus, right? But nowadays I'm seeing in their 30s as well who start to have these issues, and I think it basically goes back to lifestyle. So I have cases where they come in like, I really don't have so much drive really, and of course I check and find out what's their lifestyle like. So most of the time also not ideal, their lifestyle, long working hours, poor eating habits, not really exercising. So all those factors lah, same, or even smoking. Where that thing I forgot to mention, so smoking, smoking a big thing. Okay, so also, and then when I after assessing everything, get him to start the changes step by step and introducing testosterone because their testosterone is so low, their life change. Their marriage improved a lot, and the wife even come down to thank me.
you.
mashallah.
Wow. So lifestyle really affects men's overall lah. Overall health.
I mean, not just, we talk about in general health also. I mean, keeping a healthy lifestyle is always very highly recommended lah, because not just for health benefits, but it makes us feel better. So it makes us look good. Then we tend to be able to be in a better mood more often.
Yes, exactly. Yeah.
But tadi, I want to ask a bit more for Yan punya situation lah. So just now you said testosterone and fertility tu macam ada dia punya connection, but it doesn't directly correlate, right? Yeah. So doesn't mean that if a man has low testosterone, it means that he has a low sperm count.
No, doesn't mean so. Yeah.
Right. Yeah. So like, I macam nak buat consultation lah sekarang. I want to use you as a case study if you comfortable lah.
Go for it.
Yeah. So
Make me a case study.
Yan punya situation is that how's your testosterone levels normal?
The previous time they said that it was below average.
Below
the doctor
average?
mentioned it was below average, and they gave me this testosterone pills or something like that. And then the next time I took the test, it said it's like just nice. Then it was just nice all the way.
Just nice all the way. And then we did the semen punya
the operation,
right?
Yeah.
So they found out that after him increasing his testosterone levels, his sperm before this was 0, but after taking the testosterone boosters, dia punya sperm ada, but the sperm quality is not there.
Dia macam it's not fully developed sperm.
It's not fully developed sperm. So in his situation, kalau dia makan or like load up on testosterone, will it help his case?
So like I think I mentioned earlier, testosterone, if you take too much, it also can affect your fertility. So doesn't mean more means better fertility. In fact, it could be the opposite. So I always advise those men who are starting testosterone, whether they are planning to have kids or any more kids. Because if they do want to have kids, then you have to take a break, stop from testosterone, and before they start trying.
Interesting. So testosterone is not the answer for you lah.
It's more of hormonal, is it?
No, so like see, I mean I have to see the proper picture, all the tests, and but I didn't get to see everything lah, so I cannot comment specifically what it is. But a lot of the reasons why men have fertility issues is usually lifestyle related. So just now I catch something that you used to work shift work, smoking is another big factor. So all this contributes. Whether it's the main factor, I'm not sure, but it could be. So there's always, I mean, maybe if you can improve all these things, there's always a chance maybe you could improve. And
the chances might be higher lah.
Yeah.
I mean, of course, dalam itu kita pun takdir Allah lah kalau dapat kan.
Yeah.
So your sperm quality too is really because of your lifestyle, stress, smoking.
Siapa isap aku? Siapa?
Okay, so how to increase the sperm count, doctor?
So
is there any way to do that?
Okay, generally doctors we the simplest treatment would be supplements. So these supplements usually include things like amino acids that helps to improve sperm count, sperm volume, the strength or the speed of the sperm, and also antioxidants like CoQ10. Because all this protects the sperm from free radical damage, because it's the smoking causes free radicals and it damages the sperm. Not just smoking, stress, too much sunlight, all these other things around us, our phones, all the radiation around us. So all this causes free radical damage. So the antioxidants is supposed to protect from damage.
Right. Last time there was I think during when I was in secondary school or something, they always say, "Hey, don't put your phone in your pocket. Later sperm die." Yeah. We always say, "Hey, don't put phone in the pocket. Don't put pocket."
Oh, interesting.
Yeah, because they say radiation. Exactly.
But now when we put it in our pocket.
Exactly. Then adik selalu orang make this joke, kalau naik motor panas-panas nanti telur terbakar.
Allah. Faham.
There's a point. It's hot, you know. It's very hot.
Yeah,
That's the
it
point
is hot, humid, unhealthy.
It's not conducive for the testicles to be in a very hot environment.
Right.
Okay.
Tight pants is also, sometimes tight pants is also another factor. It's too tight, it causes more heat. Then
Must wear looser pants.
lose
I
up.
always wear loose pants.
Alhamdulillah.
I used to wear skinny jeans lah back then when I was skinny.
I mean, I'm asking these questions because maybe some of you guys listening out there, you're also trying to conceive, right? Then you are racking your brain like, what can help my husband, you know? But and the simplest solution usually kenapa ni? And the simplest solution is usually just maybe buy a testosterone supplement lah, and then ask your husband to eat, you know. But as we have learned today, that you nak kena.
It's not just purely testosterone.
It's not the right solution.
It's not the right solution.
Yeah, like flu medicine, you eat antihistamine. Asal boleh ya?
Antihistamine is for runny nose lah.
But betul. I'm right. Yeah, if you have runny nose, you eat that. You don't, and then if you don't eat cough medicine if you have flu. You might find the right solution to the right problem lah. Right? Cannot just anyhow whack only.
A few more of the misconceptions. A few more of the misconceptions just now we've already touched a little bit on. Like this one is testosterone's level only drop with age. It doesn't only drop with age, right?
Yeah.
There's a lot of things macam Dr. cakap tadi, smoking,
or the lifestyle factors.
Factors.
Yeah. I mean at the same time pun testosterone levels ni I would say of course I'm very affected by the smoking.
Can I accept it?
Yeah, I'm not in denial. It's just a hard pill to swallow. Okay. Because no, I'm not addicted. I cut down a lot on my smoking. Alhamdulillah.
Yes,
It's
I acknowledge.
Yeah, it's more of me trying to kick the habit lah. Because it's something that I find a social habit. I'm just giving excuses.
So you may need to find different friends. Unfortunately.
Yeah, betul.
Yes.
I mean,
this marriage ni kita insyaAllah is for life, right?
Yes.
We have to understand a bit lah. As a wife also we have to understand a bit macam about men's health. Because we want to grow old gracefully together, right?
Yes, for sure.
Yeah, so in this case macam for testosterone wise, we understand that testosterone does not only mean sex drive and everything sexual, but it also affects your emotional, holistic, your psychological, your mental well-being, everything macam correlates back to healthy levels of testosterone.
Which I want to bring to the table because I watch your TikTok. You know, there's one video that you talk about, you know, being a man, especially in Singapore, in this country.
Yes.
Being a man in itself comes with a lot of responsibilities, as a husband, or for some of you as a father, you hold a lot of responsibilities on your shoulder, and it affects how it affects a lot in terms of our health, our mental health. Like early on also you mentioned stress also affects testosterone. So all this weight on our shoulder, it is stressful. Without a doubt, it is stressful, to provide food on the table for the wife, for the kids, and then to provide the house. Ni semua adalah nafkah sebagai seorang suami kan. So that in effect, I'm so sorry guys. That is a factor that can affect kita punya testosterone levels also.
Yes.
So as a doctor that what do you call it? An advocate for men's health, I would say, what are your certain, what are some things that you can share with us, that in your opinion really can boost, or rather for words of motivation for men, to really see that this is something that we cannot avoid, these responsibilities, but what are some things that we can do to, make sure that we power through these struggles together as men. Yeah.
I think one of the challenges for men is because we don't really talk about it. We like to keep it in.
That's true.
Because I think there's a lot of expectation that as men we need to suck it up.
Yeah.
You're not supposed to cry. You're not supposed to feel sad. You're just supposed to like take it like a man. They say, right?
Yeah. Oh my goodness.
Yes.
I've seen comments like, laki ni banyak nangis. Ni lemah laki ni. Yeah.
So is this is all this what we call toxic masculinity that's affecting what a real man should be. Because if you need help, you need to reach out. And I think one of the important things is to be able to speak to somebody. Could be your partner, could be a friend, could be a professional, anybody. As long as you just reach out to somebody and just, sometimes you don't even need a solution. You just need to speak it out, say it out. Yeah.
Right.
Because they are just keeping it. So important to have that friends, family support, social support. And maybe if you are around somebody, your friends or your partner, you can just ask how are you, and just check in them, whether how they are doing, and leaving it open so that maybe if they want to say something, they can share it with you.
Right.
Yeah. Okay. So the last one also we got touched a bit about it before, but just to share, testosterone boosters are safe because they are natural. Macam the over the counter you see, bang, pergilah beli testosterone. Okay lah, kawan abang cakap yang ini okay, beli je lah, try.
Oh, I actually have I just recalled a incident. My friend who is in his 40s, he started taking testosterone boosters. So and then he's in 40s, the wife also in late 30s. They had children, but then very long in the marriage. Then suddenly he came to me. He was like, bro, I've been working out. He said this, bro, I've been working out. But then now I take this testosterone booster. Now my wife pregnant. Yeah. So I mean, if let's say if I'm right, based on whatever Dr. Taufiq has mentioned just now, it's not necessarily the testosterone booster that he's taking that gave him a child.
It might be the lifestyle change.
Yes, because he literally started gymming, he started going for runs, and then he was getting more healthy. But then in his mind, he said, oh, it's a testosterone booster. I feel more and got child.
Is it safe to say that the testosterone helped him with his energy levels? That's why he can go to gym?
It's possible. It's definitely possible. We wouldn't know, right? But there's always the dangers lah, because there's a lot of stories that are here where men buy supplements online, especially from our neighboring countries. Unfortunately, there are a lot of cases that they found medication inside.
Medication.
Yeah, and sometimes they just kopi, like sometimes they buy kopi, right? Like for example, kopi jantan.
I was about to say that.
So do you think kopi, how dangerous can kopi be, right? But they found they put Viagra inside. So imagine this. Pakcik, just drink kopi. You can drink 3 times a day, kopi, right? Wow, imagine you drink so much Viagra. What's going to happen to you,
Oh no,
Right.
Pakcik.
Because, Viagra, let's talk about Viagra. Because that piqued my interest. Because I know Viagra is an erectile dysfunction pill, right? It helps you with your erection. So, same thing, a bit too much can actually cause further dysfunction. Am I right to say that?
It doesn't cause further dysfunction but then there's always worry about side effects when there's too much. So, and then also there could be interaction with other medication. If you don't see a doctor for it, then sekali interact with your medication, it can cause fatal consequences.
Right. Okay. Maybe you can run through with me a bit about this erectile dysfunction, because I feel that we haven't touched about it in the episode, right, about erectile dysfunction. So erectile dysfunction means even if you have the mood, you cannot stand, ataupun you have the mood, no mood, that's why you cannot stand.
Okay, just by definition alone is just the ability, you don't have the ability to have a good erection, whether to initiate the erection or maintain the erection for sexual satisfaction.
Okay.
Yeah.
Wow. Okay.
Hope that answers the question.
Yes.
Not related to mood or not.
Faham. How frequent is erectile dysfunction in men?
It's definitely not rare. It's actually getting more and more common. And I think a lot of things maybe in the younger generation.
Okay.
Because I'm seeing young men also with these issues in their 20s. Of course, if you're younger, most of the time it's psychological factors. Okay.
Stress.
But then older men will be could be related to testosterone. But it could be a combination. Lifestyle factors, testosterone, could be psychological, could be everything all in, all contributing to that problem.
Okay.
Yeah.
So in your treatment for erectile dysfunction is that pump? One of it.
So like one of it is the pump. So because the pump is non-invasive, no pills, and you can do it on your own. It's like a exercise or workout for yourself. And of course, other treatment includes things like just now I mentioned Viagra, medication like Viagra, Cialis, all these very effective to give you the erection, the quality erection that you need for function. But of course, the best if you can address the causes of the erectile dysfunction, then you don't have to rely on the medication. I also have another treatment that's non-invasive. It's called a shockwave therapy. So it uses low energy shockwave to apply on the penis, and it improve blood flow. Yeah, but no pain.
No pain.
You just feel like tapping sound. No pain, don't worry.
Right.
Yeah.
This is more for my knowledge purposes. This is for knowledge purposes because, like Doctor mentioned, it's not a rare phenomenon. It can happen due to certain factors in your life, and then. Yeah, we want to prevent that because we want every husband and wife out there to feel comfortable with each other, to have that physical intimacy, which is important in a marriage.
Yes.
On top of whatever else is important.
In fact, erectile function could be one of the earliest. It's one of the signs of health, good health, and there's a dysfunction. It could be early sign of a chronic condition or poor health. Like I've diagnosed a few guys who came in for that problem. But he's not done any health screening and then found to have diabetes or high blood pressure.
Oh my God.
So all this can contribute because your erection is all due to blood flow, right?
Yes.
The first thing that your body will sacrifice will be that if there's some problems with blood flow.
Interesting.
So that will be the first sign that something's wrong.
Oh my God.
God. And just now doctor said as early as 20 years old, young people like that. Right?
Yeah.
And I also want to ask doctor macam over the counter punya supplements, we just talk about testosterone lah. Macam I very scared he will buy something that is macam can cause harm to him because we know there's a lot of macam copies, right? It's not the original one, but then they make a macam a counterfeit lah, like a fake one. Is there a way to tell tak?
I think if you really want to go into details, you can look up the batch number. You can find out the where it's made. But of course, first you must know that the brand is a reliable brand first lah. If that brand is not reliable already, then no point lah.
So the best is always go to doctor lah. Anything to put inside your body in terms of medication, you have to seek a professional lah. Other than macam normal headache ke apa, okay, you can just get Panadol. Not sponsored, Panadol.
So I've been a bit quiet this episode because I'm just absorbing a lot of things. But Alhamdulillah, I've learned a lot of things about testosterone, about fertility, about men's health, and inshallah I can help you lah. In this journey of becoming healthier, and it can contribute into our marriage.
Inshallah. Inshallah.
I think it's good you just focus on your own health, not focus on the fertility, not focusing on fertility. Focus on your own health. Take it step by step. Start improving daily habits. If it happens, it happens. Alhamdulillah. If not, you'll be healthier.
That's true. That is also a good benefit. Being healthier, then we feel better. We can do more episodes.
InsyaAllah.
Inshallah.
InsyaAllah for the insiders.
Yes.
But thank you, Dr. Taufiq, so much.
Yeah, maybe before
for
we
the
go,
sharing
maybe you
today.
can share your socials and also
yes, your
one more time to
clinic.
plug in
Yeah.
your clinic and your services so that mana tahu orang boleh get in touch with you.
Okay, so my clinic social will be TAF Clinic, TAFCLINIC. My doctor professional TikTok is called DickDocSG, DickDocSG.
Dia macam TikTok.
The first time I saw, I'm like, TikTok. But it's a very clever play of words.
Yeah, it works. So and then also I'm also on Instagram and Facebook, so can find TAF Clinic, and for Instagram will be my Dr. Taufiq Rashid, DrTaufiq Rashid.
Okay, so any services pula. Any you want hantar nak pergi sunat, you know of friends who want to have a better, healthier penis, go for consultation with Dr. Taufiq. Men's health basically. So he covers a lot. And like you see, he's very friendly, very fun. We had a good conversation at the couch over there just now. It was very fun. So feel comfortable. Go and search for Dr. Taufiq for his services, inshallah. Thank you so much, Dr. Taufiq, for this episode.
Thank you so much for having me.
Yeah, inshallah, we'll be able to meet again. If you guys have any questions, do drop him a DM. And get yourself checked.
Betul.
Be healthy.
But if you want to cari rumah, you can cari
NAZRI
NAZRI
Baobed.
Yes, you can contact him at 90. Alamak.
Kena cari.
Selalu tak prepared for this.
Itulah. Sekejap, minta maaf.
Hey, Abzain, where? Okay.
Yep.
Okay, I will say again. So, if you want to cari rumah pula, jangan lupa cari NAZRI Baobed.
Yeah,
You can contact him.
Contact him at 90688244 Korang nak upgrade ke, korang nak sewa ke, korang nak apa-apa lah, anything to do with hal ehwal hartanah rumah, go and contact NAZRI Baobed.
Yes.
InsyaAllah orang dia pun Masya Allah, tabarakallah.
You can also follow him on Instagram at NAZRI_Baobed.
Alright, with that, jual dan beli rumah, tak payah stress lagi. We've come to the end of another episode of Outside In.
If you like what you hear, please follow us on our socials: TikTok, Spotify, YouTube, and TikTok.
Instagram. Share with all of your friends and family members so that they can benefit from this episode, inshallah. Till next time, Assalamualaikum.
Salam.